Okay. Okay, so if you're looking at this model, this is showing you the lungs too. So we did this part already: hyoid bone, thyroid cartilage, thyrohyoid membrane. This is the cricoid cartilage. This is the thyroid gland, by the way. This gland here, and the parathyroid gland will be embedded in the back of the thyroid gland. But you can see one, they removed the other one, so you can see what's underneath. But you have two of them. Here's the right one, right thyroid gland. And then these are, this is the trachea, start from here. So this is the larynx. This is the trachea, start from here. And now the lungs. We have right lung, left lung. If you look at the fissures that cut the lung into three lobes, you have, this is transverse or horizontal because it goes like this. And this is called the oblique. It's going obliquely. So by the transverse and the oblique, you have three lobes in the right side. And this corresponds to this. And that's why when we talked about this, we said you have three in the right and you have two secondary in the left, because the three in the right correspond to the three lobes. The two will correspond to only two here. So if you go to the left lung, you only see the oblique fissure. We don't have the transverse. So this so the difference between the right and the left. The right is three lobes, the left is two lobes. Why? Because we have the transverse fissure in the right side, no transverse fissure. So we have two lobes only? Yes. The third lobe was occupied by the heart. That's why we have on the left side, we have only two, and that's why we have only two secondary bronchi on the left side. Okay? So this is the oblique fissure. This is called the upper left lobe, lower left lobe, upper right lobe, middle right, lower right. So what's disappearing here, does not exist? This one, which is the middle, because it's occupied by the heart. This curve here, this is a curve or a notch that's done by the heart, so we will call it a cardiac notch. If you open this and look further inside, you will see these silver that contain like cartilage rings. These are actually the tertiary bronchi. And the blue vessels, these are the pulmonary arteries, branches of the pulmonary arteries. Remember, the pulmonary arteries are blue, the pulmonary veins are red, which is the opposite of everywhere else. Again, when I opened this, it's showing you what's inside, which is these that have transverse cartilages like this. This will be the tertiary bronchi, and the red would be the pulmonary veins, and the blue would be the pulmonary arteries. If you look at the heart here, this is the pulmonary trunk that will give you the right and left pulmonary arteries. Right pulmonary artery to the right lung, the left pulmonary artery feeding the left lung. And if you look at this, this is the brachiocephalic vein. This is superior vena cava. This is the right brachiocephalic vein. This is the left brachiocephalic vein that will give you the jugular vein and the subclavian vein. It's different from the left side. On the left side, you have, this is the brachiocephalic trunk. This is the right common carotid, and this is the right subclavian artery. And the left side, both of them arises directly from the aorta. So this will be the left common carotid, and this will be the left subclavian. This is the diaphragm, the whole muscular partition here. This separates the lungs or the chest from the abdomen. Here is another model that's in the torso, and that's showing us the lungs too. So this is part of the respiratory system, and you can see right lung, 3 lobes, left lung is 2 lobes. But if we open this and you look closer, this is the model that's showing you the pleura. So if you come closer, you will see here is one white line, and this is the visceral pleura, and here's the outer one, which is the parietal pleura. And the space in between this line, this is a pleural space or the pleural cavity. So here are the 2 white lines again. The one that's toward the lung, this is a visceral pleura, and the name coming from viscera, which is a lung, visceral. So this is a layer that's adherent to the lung, which is the inner layer of the pleura. And here is the second one, the outer one, which is the parietal, and the space in between those 2 whites, which is this, that will be the pleural space or pleural cavity.